This meeting will be video recorded and broadcast over local access channel 8 and through the town website at www.eastham-mass.gov. It's the Eastham Human Services Advisory Committee meeting on November 12th, 2025. And it's 6:34. Well, all right. So we have everybody here, two of us by Zoom. And our first order of business on the agenda, as I said, I sent you one with the wrong date on it. I noticed I missed dates on a few things. I think I'm trying to hold too many dates in my head. So the and then attached to that same email were the minutes from January 22nd that we have created and the minutes from November 5th. So let's first look at the minutes from from January 22nd and get those taken care of. Are there any changes to those before we yes, Elise had given me her notes from that meeting, so that's what I used and just typed them up so that since I didn't have them in digital form, I had to put them into digital form and look at my own notes. So once you have.
I read it, but I don't have much,
Okay.
but they were good, but they were fine.
Yeah.
A meeting paper I have. I will accept any motions about the minutes. Well, first discussion, if there's any discussion. And then a motion.
I move we accept the minutes of January 22nd, 2025.
Okay, so we have a motion.
Who's seconded?
And it's been seconded. And now, is there any other discussion? Okay,
No.
and all those in favor of accepting the minutes from January 22nd? Aye. And I would assume, Billy, that you're abstaining just because you weren't here at the time. All right, so we have accepted the minutes from January 22nd, and I will get those to town hall. And then we have the minutes from November 5th that Hilda did took her notes and got them to me. And we had. So I don't know, I think before I sent them to you, I changed the date from the 4th to the 5th. But if there were any changes or any discussion on any of those, on those minutes. And when you're ready, I'll accept those.
Good job, Ruth. I'll move that we accept the minutes on November 5th.
Okay, so MJ has moved that the minutes be accepted.
I'll second that.
D is seconded. Is there any discussion on them now?
No.
Okay, so we'll go to a vote. All those in favor of accepting the minutes from November 5th? Aye. Any opposed? All right, and I guess Billy will abstain. She wasn't here for those. Okay, but those are, thank you very much for having those, and I'll get those to town hall. And then to go over Wayne did bring up the AI business last week. We had a little bit of a discussion about using the AI. They generate notes. It generates notes about, our Zoom meeting. And, I did email the town clerk, Linda Sassy, and through her, she also sent it on to Jackie, to ask them, is this acceptable? Because, you know, I had my, I needed to have it be okayed by, Powers. Linda actually was going to look into really making sure it fits the open meeting laws and whatever, to, you know,
Interesting.
but Jackie basically felt that we could use them as notes as long as we edit. And then, of course, they would have to be then, read and accepted
Yeah.
and, each time.
Right.
So, Wayne has tried to get to the notes and send them to us, but it didn't seem to go through.
Interesting.
So,
If I can just say that, I spoke to the clerk at the, search committee, Merrill.
yeah,
And he uses the AI
Okay.
summary. For our minutes.
so what we need to know,
And he goes through Devin.
okay,
He emails Devin. And Devin emails him back the summary,
okay,
and there it is, it's done, and that this past
So
week,
he can,
he sent those.
he can edit it from what the email comes from.
I think he does, but I'm not positive, yeah, but that's the steps that he takes.
Yeah,
yeah,
well, I would think the editing, I mean, it must be able to edit or just deletes things without.
The
I guess.
50 minutes that he sent out to us this week were
Yeah.
almost exactly AI
Yeah.
summary,
Okay,
so.
yeah.
Billy, do you use AI on your minutes, keeping the minutes? You just do it all by hand?
No, I just type as we go. But
And
You know.
basically, that's what AI is doing.
yeah.
right,
So it,
But if you're not here, that becomes a problem.
well, you know, so we could continue to use Billy. And I can get you I have Devin's email if you wanted to get that summary and see what it was like. But it seems as though it's a whole extra step if she's sitting there with her computer taking notes.
Yeah, it's easy enough for me to just basically transcribe the points that are important and like do the filtering as I
Yeah.
listen. Whereas with AI, we'd have to edit every utterance essentially. I think.
I think AI does some of that. I think
Yeah.
it takes some of the extraneous conversation out.
If
That's my
you ask for the
That's my
summary,
understanding as well.
I think there's a difference between the transcript and the summary.
Could I make a
Potentially.
suggestion?
Right,
Is there any possibility that we could ask Devin to give you a copy, Billy, that we could then look at, and then we could say, this does not work.
Yeah,
Or,
I
yes,
could
it
get
does."
it, and so
Could
that
you?
we could all see.
Yeah, and then see how we like it,
decision.
if we like it or not.
Having taken minutes both at the search and here, I have a problem keeping, no, you're much better than I am, because you must be able to multitask that brain. Mine is too old to do that, Billy. So if I'm trying to listen and contribute to the discussion, I'm afraid I miss things, and hopefully I don't. But then I think if I'm taking the notes, then I'm missing stuff, or if I'm listening, then I don't take the notes.
Right.
Yeah,
exactly.
So it might be just good to look once at.
I agree.
What's
So
the AI
I'm
look
going
like?
to do that and have him, and I can have a little conversation. Are there, point by point notes?
Exactly.
And then are there two separate documents
Yeah.
and such?
Okay,
And it might be
summarize
interesting
with
to
both
see.
things. Yeah.
And we'll have,
And then Billy.
Billy can keep doing it, but I'll so
Yeah,
we all can sort of
exactly.
see and get a sense of it.
Yeah.
Because if she isn't here, then potentially we can access that.
that would be
Right.
the way.
But I still think you'd have to have somebody assigned to the minutes, whether she's here or not,
Oh, somebody has to,
right? You have to.
Because you need to take down the essential points of everything, so that
Yes.
then you have something to
Compare
compare
it
those notes
Yeah,
to.
somehow I don't think you can get away with never if Billy isn't here, not having somebody
Yeah,
or someone, yeah.
right, but that way there would be, if we got it every week, then she
Yeah.
would have something to check her
Absolutely.
against and whatever.
Until at least we were familiar enough with it and that we learned it so that we could trust that it is saying, yeah. I mean, I don't know if that's like a forever thing.
No,
I mean, it
but-
kind of defeats the purpose.
No, it's
if-
like, look at it
Yeah.
once, see what it looks like.
Oh,
It's,
yeah, or a couple of
Okay.
times, just.
So I
Yeah.
will,
See if it-
I will start by emailing Devin. I do have
Good
his
idea.
email and,
Yeah.
and get that going.
Yeah.
And the one other quick thing before, because Katie is here waiting. I spoke with Dorothy at the Council on Aging about mustard seed, and she did not have the information right on the top of her head, which I would have been surprised if she did, but she totally understood what I was talking about. And so she was going to look and talk to the friends to see if they were going to do anything. And, you know, so because she said all they need to do, she needs to do is send a letter. So she was gonna check to see if there was a letter, and I might prod her Pat into doing it. Because I guess Pat comes to the senior center for some activity, plays a mahjong or something, I don't know what, but it was
At,
very,
at our,
okay,
at our.
yeah. Yes, at our,
Yes.
she comes down and plays,
Okay.
does something, and she said, you know, she's a lot taller than you would imagine. Dorothy was,
very cute.
the place, there was no parking spaces, it was so busy at the Council on Aging. All right, I will let Katie and Jerry in. Hey there. Hi, Katie.
Guys.
Hi, Jerry.
How are you?
Hey, how's everybody
Hey.
doing?
Good, thank you. How are you?
Good, thank you.
All right. So we have now Lower Cape Outreach. We got both of you tonight. That's exciting. And we do have on the screen with you is our new member this year, Billy Ann Starks. The rest of us were all here last year, and Felice is also on the screen with you, but she was here last year and many years before that. So we
Welcome to
are,
Billy, welcome.
yes, she's a wonderful
Thank you.
addition.
For sure.
And we won't let you coach her from the children's place. But anyway, so in looking at your application, it's you know, it's we always keep shaking our head, you know, don't we wish we could have $1 million to help everybody? But it's interesting, and I would really like you to give us a sort of a sense of how you are doing there at Lower Cape with all the different things that are happening in the country, but also around here.
Sure. Well, of course, we're focused on the Lower and Outer Cape, but you know, everything that's happening countrywide is affecting us as well. Not unsurprisingly, similar to the last few years, the food program is what continues to surge, for a lack of a better word. Since I started in 22, we've had unprecedented growth in the food pantries. I wish I could tell you exactly what that was caused by, but I think it's a combination of factors. So I think it's inflation. I think it's the housing crisis. I think it's the rising cost of food. I think it's the rising cost of fuel and everything else that families are facing in today's economy. This year is no different. We're tracking about a 25% increase across our food pantries over last year.
Wow.
And that was before November 1st. So
Before SNAP went away.
Yeah.
exactly. We haven't quite gotten the full understanding of who received SNAP benefits, who didn't, and how that's all kind of playing out at the moment. What I can tell you is we looked at last week, a year ago, and last week this year, just to see what it looked like after the, you know, folks didn't get SNAP benefits at the beginning of the month. And we had a 61% increase at our main food pantry, which is the one in our headquarters here in Orleans. Hopefully that is not the continued trend and that number comes back down once folks receive their benefits.
Yeah.
And again, I don't want you to think, I don't have the numbers from all of our food pantries for last week yet. That was just the one that's in our office at 19 Brewster Cross. And just for Billy, maybe I'm not sure how familiar she is, but we have a pantry in each town that we serve, including Eastham, obviously. And typically those pantries serve those who live or work in that town. Our Orleans office, where we're headquartered, where we're staffed, because it's centrally located, because we know most folks need to come to Orleans for one reason or another at some point given the month. We welcome any resident or anybody working in all of our service areas to visit this food pantry. So obviously that includes Eastham folks if they're in the area. We found that this is the most convenient for us to obviously staff because we're in the building. So it's open Monday through Friday, as well as evening hours on Wednesday. So that's where we're at. So, you know, given everything that's happening, you know, we haven't really seen the full effect of the cuts to Obamacare and everything else, but we're anticipating those to be an additional strain on the folks that are utilizing our services. And I think time will tell over the next weeks and months what that looks like.
Yes, well, because everybody's heating bill is now started up and, you know, and to think if there is a way to at least have food on the table and, you know, use that money for one of the other bills, it is wonderful.
If I could add, Kate, you know, it's sort of the
Sure.
perfect storm because, you know, with the healthcare spikes that people are going to be experiencing, and also it's important to realize too that before this whole snafu happened, 1 in 3 Cape Codders were considered to be food insecure on some level of the scale. So I think the SNAP, it's a silver lining that it's brought the issue to the forefront.
Yeah.
And we're also getting people newly interested in helping our cause and helping food pantries across the state and the nation. But it's not just SNAP. You know, there was a base underlying serious issue that, you know, we were already addressing by starting to triple the size of our main food pantry in Orleans that should open in a few weeks. We have a temporary food pantry right now. Since May, construction has been going on, and we hope to be opening that new pantry in the coming weeks. We're already using it on the ground floor of our building by packing our Thanksgiving meal distribution to over 800 families this year.
Are you gonna collect turkeys again?
We sure are. The farm was generous enough to run the collection. That's this Saturday, 10 to 2, I believe.
So yeah.
But they've done that every year. Every year we bring in about 200 turkeys additional with some monetary donations, some other donations for Thanksgiving meals. And we're hoping to exceed that this year, just given everything that's going on. I'm hopeful that the community will show up as they always have.
Yeah,
Katie, what Saturday are they going to, what Saturday again? The Saturday before Thanksgiving?
This Saturday. This
This
Saturday.
Saturday.
Oh, this coming Saturday,
Yeah,
they
yeah.
want, and frozen, right?
Yes.
Yeah.
I want them
Yeah.
to-
Okay, thank you.
And can you drop
See.
them off earlier than this Saturday? It has to be.
You
this
are
Saturday.
welcome to drop them off anytime you can at our office. We are happily
Bring it to
accepting
the
turkeys
office,
anytime.
but yeah.
Farm, okay.
And if
Right.
you're
Thank you.
if you're around and you want to see
Yeah, I've
the
done that before, just didn't know what day.
Yeah,
At the farm.
yeah.
Okay.
if you're interested and you are at the office, feel free to ask for a tour of downstairs. We're pretty excited to have it open, but it's quite a
It sounds-
transformation.
It is, it's nice to have really looked at your space and realize how better to use it potentially but to have then the resources to be able to reconfigure. Because that, you know, certainly is, you know, costs, you know, money, but it'll probably be wonderful, a better way of using your space and have it be, you know, just more accessible for people and such, and, cause Katie's Corner was also gonna come upstairs too, you said.
Yes, you're absolutely right. So we're just about finished. We're about a week or two behind schedule. I would have loved to have that pantry open already, but we're given everything. We're pretty happy with the timing, and we're hoping. Don't quote me. We still need a board vote, but we're hoping to start construction to reopen Katie's Corner as early as January, and that'll be open for spring. I think not only our clients but our volunteers and our staff are all missing that opportunity to serve our clients. So we hope to do that.
Yeah, because,
So Katie's Corner's not open at all.
No, it's been closed since we started the renovation. We chose to prioritize the food distribution during the renovation.
Sure.
yeah, because right, at this point, yeah. If you really needed something, you could figure it out. And also, I mean, Mass Appeal is a great spot. And it's hard, people may not be able to get there, but it is on a bus route too, if they really needed to.
61% is
That's a big
that's a
jump.
big eye opener, just for SNAP. Dropping out that quick to see.
Yeah, I mean, I think it's the reality that, some folks that were on SNAP weren't utilizing our pantries. They were able to make do with what they were provided through that federal assistance program. Because we serve a wide range of folks that are food insecure. As our, folks from the Greater Boston Food Bank are saying, hunger has permeated the middle class. So we recognize that it's not just the very low income folks that utilize the food pantry, that population is unfortunately continuing to grow in our community.
Yes, yeah. Well, when you add in how much just regular items cost, but then the threat of higher insurance, health insurance rates. And it's pretty scary to think of, somebody particularly with a family and trying to really provide for them.
At the worst time of year, we're all looking at Thanksgiving, and then of course the holidays are coming.
In the holidays, and having it be, and it's cold and dark and it's a little depressing. No, but
we're very thankful for your support.
I would say, we serve, the 8 towns of the Lower and Outer Cape, but Orleans and Eastham are the strongest, centers of support based on our history in founding the Eastham Pantry first. And Orleans and Eastham really are star supporters. So we thank you.
Oh, you're quite well. Well, we have found that the people of Eastham really have some pretty big hearts. A lot of people volunteering and stuff, and I have some friends. I often do the buy one get one and bring it over to the pantry, and such. And it's always I go in there, and the people who are working there are all people that I know, and so it's just and they're just greeting everybody with big smiles, and they've got know how they want it to flow, and it's just it's really pretty.
And I'm glad you brought up the volunteers, because we couldn't do it without everything and all of their time and energy that they put in. They more than double our staff, and are the folks that our clients are seeing right in the food pantries every day at the front desk in our office, answering the phones for our financial assistance program. So we can never thank them enough.
That's amazing to think that, it's your staff isn't that big, but yet you have you've got a lot of things going on, and you do an incredible amount of fundraising, and and really are able to keep things flowing for people and such, so that that people can get in there and get the support they need, but then they get some of the counseling. And I think that that's one of the things that really makes a difference for people, is that, you really help them look forward, and instead of just being panicked, we got this bill taken care of, to really try to help them move, to make life be maybe a little more manageable, if possible, these days. But
I saw a volunteer out at Shaw's today. was manning a table,
Oh,
lower Cape.
uh-huh, and I, yeah.
Big jar.
The big jar, oh, they
Big
have,
jar.
yes, they do, yep. Well, and I think that it's, yeah, but
Katie,
what I-
you have a thing here on your financial budget. I'm just, I'm not questioning anything, I'm just curious as to what is your restricted fund? What is that? There's a lot of money there, what happens with that?
So that's a variety of things. I'm not sure exactly which one you're looking at, but the majority of our funds are unrestricted, meaning our
Mhm.
donors entrust us to put it where the need is most dire, I guess, for lack of a better term. But we also receive restricted funds. So we often receive donations from the community that say, I want this to go to the Eastham Food Pantry, or I want this to go to residents of Eastham, or I want this to go to your new coat distribution, or I want it to go to Thanksgiving. So we have the opportunity with the program that we utilize to organize and collect all the data and the donations to what we call restrict funds. So we have some grants that are restricted. Like for instance, the Mass Department of Agriculture gave us some money to utilize to renovate the pantry. So that is a restricted donation, a restricted grant.
Oh,
So,
okay.
just depends on what the donor has asked us to do with the funds that they've given.
yeah,
Thank you.
Mhm.
And I
Just
have a
just to
question.
add, oh, go ahead.
No, that's okay. I was just
I was
gonna
just gonna say, Kate intimated to our fundraising, and it's just goes without saying, we have no fees for service. All of our services are free, so our entire budget is based on grant writing and philanthropy. And so with a lot of grants, you're writing for a restricted reason to attract that monies. The town grants are more lateral and generous, and allows us to apply where the need is needed. But as you can see for our application, it covers all of our services, financial assistance, food, clothing,
right,
special holiday programs.
and I mean. Our money comes back multiplied by
Yes.
all the service, all the assistance that Eastham people have received. Without question.
Can you just tell me what Food to encourages? I'm just, I don't know, so.
Yeah, no, it's that's
Right.
one of the programs I'm most excited about. It did predate me and my work here, but we were able to bring it back with a ARPA grant from the county a couple years ago. So essentially, it is a partnership with the county. We work with the Cooperative Extension, which is basically the food arm of the county, as well as the Public Nurses Department. And we host 8 events each month, one in each of the pantries we serve. Actually, we hosted the Foods to Encourage right here at the main pantry today. And there's a nutritionist from the Cooperative Extension that comes and does a food demonstration with items that are typically found in the pantry to encourage folks to make more nutritious meals. And then we do use additional funding to supplement the fresh produce that's available. So we partner with a local Fancy's Produce, which is right here in Orleans, to supplement the produce we can get from the Greater Boston Food Bank to make that more available. And then the public nurse does health screening. So they do blood pressure and glucose testing for folks that are interested in that in the service.
Thank you, that's great.
Yeah, yeah,
Today involved sweet potato salad and pumpkin seed. Sounded really good. I want to make it.
yeah.
They have a featured recipe every month.
No, that does sound really good, and it's the kind of thing that you wouldn't necessarily, yeah,
Know about, yeah,
yeah.
that's great.
I know, because I often think of, for my own health reasons, I follow a low salt diet, and there are some things that are, it's like spaghetti sauce. People buy spaghetti sauce, but they don't realize just how like salty it is. And
Okay.
or it is, really good, and yet it's not, every now and again, that's what I put into, because there's somebody who's coming through that they really need to have that, and it just feels like, they would be thankful. I know I would be, that it would be hard for me to go to a pantry and want to get spaghetti sauce because it's such an easy meal. and it can really fill you up. But, if you can't really eat spaghetti sauce easily, then, it is. And
That's
it's
a good
not-
point.
It's not something that you would necessarily be able to get that easily, like from the Boston Food Bank. They're not going to probably get something like that. But there are, particularly with an elderly population, some dietary needs that might be out there. And there's times that I try to fulfill that for people. That's what I'm.
Actually, Kate just brought up a very interesting point. So you hear some, and I do it from my granddaughter just was diagnosed last year with celiac. And I know everywhere in the world now appears to have some kind of allergies, children have it, adults have it. Are you able to do anything in terms at the food bank to provide those foods? I mean, you go down Stop and Shop and you go down an aisle. Years ago, you couldn't find one gluten-free thing. Now you could fill your grocery bill as long as you had enough money
Right.
to pay for it.
Yeah, I mean, that is a challenge. We have gotten more and more requests for dietary restrictions, whether it's gluten or low salt. So we do our best to fill that. But to your point, there is some. I think the Greater Boston Food Bank is getting better at having those items available. But I think the need is out exceeding the supply. But about 80% of our food comes from the Greater Boston Food Bank. The other 20% we source locally. So we do our best to try to take care of those specific requests with that. But what's interesting is what we're finding in the last few years is the biggest demand is for fresh produce. So we do our best to focus our funding there, which tends to serve all of those dietary restrictions. There's a lot that can be done.
It does make a difference, and
Thank you.
which is really wonderful if that's what people are looking
Asking
for and asking for,
Well, that's what
because
they
then.
should for.
Some other interesting
Yeah,
news,
Can I ask a question?
Sure.
I'm Ellen. Hi, how are you?
Hi.
I heard on the radio that there's a philanthropy day in Hyannis. I think this weekend or next weekend. Do you guys go to that? Does everybody go to that?
next Wednesday, yep.
I
Okay.
do. In fact, Jerry chaired one several years ago, didn't you, Jerry?
I was a younger buck then. For 2 years, I co-chaired it, yes. They get about 500 folks. It's the biggest philanthropy
Wow.
event on Cape Cod.
Wow.
And they have
So that's
some
like
awards.
500 agencies, or how many agencies? How many agencies would you say?
Well, it's open to the public, so a lot of board
Okay.
members come, a lot of staff, a lot of volunteer people interested in learning. So it's really but how many agencies? I would say at least 100 if I were to guess, but I don't know offhand. But this year, they have 4 event categories, and this year the philanthropist of the year is a young boy who did those cooking programs with Homeless Prevention Council.
Oh my
You
God,
might have
that's
seen him in the
great.
news. And he's going to be the philanthropist of the year. Usually it's an 80-year-old person, and it's going to be a young boy. And Tom Evans is the volunteer of the year, very involved with Harwich. And so it's a good field day, but it's also educational at the same time. And it's affordable for access to education, on the Cape.
Nice.
Yeah,
All right.
and what a great, to have a younger person get it, and that is going to, inspire, I'm sure, other
Yeah,
young people to,
yeah. It's going to be the
try
best
hand
moment.
at it. Yeah.
You can tell Jerry's very excited.
They used to do
His
the
college
video
essay is
too,
all
so
done.
yeah.
Oh,
Nice.
dear. Oh, that's great. Well, that does sound like quite an event too.
Yeah.
Have to think about that. That
Yeah.
could be a fun thing to go to.
Yeah.
All right. It's impressive. The holiday toys, how do you get things from Toys for Tots?
Yes,
Yeah.
absolutely. We partner with them since the inception of that program. But in addition to what we get for Toys for the Tots, we're grateful to have to be the recipients of all the fire departments that do Homeless for the Holidays, including Eastham and Orleans are big supporters of ours.
Yeah.
And then Cape Cod 5 does collections for us. Snows does one for us. There's a variety of local organizations that contribute to it. So it's a little different than some other organizations for their gift giving. It's an opportunity for caregivers to come and shop for their the children in their lives. So we separate the toys by age and gender, and you can sort of look around and shop, and then we do gift cards for, you know, middle school and teenage kids because they're more challenging to find the right thing for.
They are anyway. But gift cards is a really good, because then they also gives them a chance to actually have some way to spend. And because that's what they want to do. But that's great. I mean, those are good. Because it's always nice to know, I'd like to know that what I am donating like that, particularly for Christmas things, is that it's going to local groups, local people. And such. All right. The Thanksgiving, the turkeys. Okay. Anybody else have any other questions? It's been fantastic. We are, you know, it's always wonderful to hear you, and it's great to know that your organization exists for, you know, people to walk in the door and try to, you know, at least if you can't help them directly, to at least, you know, learn how to get to the next step. But we're lucky around here for sure.
It's good.
And so we have been asked to level fund. We're not sure how we're, you know, going to be dealing with. We understand all the restraints that you also have in what's been going on. So we will do our best, and once we vote for our allocation, then we let, you know, the usual way goes to the select board and the town administrator, who puts it into the town budget, and it gets voted on by the town. And here in town of Eastham, if there's barely a ripple when it comes to that whole piece. I mean, it's lumped in, and it can be an increase and nobody even notices. But thank you for all you do, and we
Likewise.
appreciate you coming and joining us tonight, and you know, keep doing the good work, and got these two big holidays to come to besides getting into the heating oil season too, besides all the food. But good luck.
Well, thank you.
Yeah.
Thank you all for your time and your commitment to doing this work.
Once I hear that the pantry's open, I'll have to stop in and just take a peek and see.
You're welcome anytime.
I'm sure.
Have fun at Philanthropy Week.
Yeah.
Thank
Yeah.
Do you have a song and dance ready?
Thank you, everybody. I hope you have a great night.
Good night.
Appreciate your
Thank you
time.
very
Good night.
much. Thank you.
All right.
Say I get depressed after these presentations.
I know. I know.
I get
Good
depressed
discussion, Eve.
thinking of 1 in 3 people on Cape Cod are
Food
food insecure.
insecure.
1 in 3.
1 in 3.
There are 5, 6 of us here.
Yeah.
I mean, 2 of us. No, I know.
I
we're
would
not
really
gonna
love to
do
see
that.
the measurement on that.
It's just incredible.
How they measure that.
I'm wrapping my mind around it. Still, I'm sending, but I do accept that. You know, it's generally.
There's 5,000 people.
Yeah.
In
Yeah.
there.
Yeah, exactly. It just doesn't feel.
And the idea that in
The
a,
kids too, that
Yeah.
support in the element, it's like 35%.
yeah, it was very high, you know, last
there's
week when they were talking the number of kids on, you know, getting help with lunches and such, and and to think that the food pantry visits went up that much. I mean, there had to have been a line at the door. Yes, food is,
Expensive.
it's expensive on the Cape also.
And you wonder, I'm assuming that here on the Cape, there are federal workers who work remotely,
Yes,
who aren't getting paid.
yeah,
Haven't gotten paid in a month.
Everybody at the, you know,
yeah. My
as a national seashore,
Yeah.
you know. Well,
My son
that's
has a
dangerous.
baby.
All those people.
He doesn't live on the Cape, but 45 days, yeah.
How is it supposed to
Now,
get?
now I heard somebody told me, did you tell me, or somebody told me that 60% of the children in the Dorset school system are being raised by people other than their parents,
Yeah, where
like
did we-
grandparents.
Oh, I didn't hear that. I haven't heard that.
That seems pretty
It was-
high.
Yeah,
Yeah.
they told me that, oh my
Yeah.
God, I'm just thinking it was a
If there's some.
reliable, is that more?
Parents, Billy, have you heard anything?
Have you
like
ever
that?
heard that?
Was it
Well, we
familiar?
definitely, I'm not sure exactly what the statistics are, and I'd be curious to look into it more. And how we're measuring that exactly across the county. But it's
Yeah.
true that there are a number of grandparents raising grandchildren that we take care of. And, we're trying to expand our services to be inclusive of grandparents who are parenting their grandchildren. But
Yeah.
then there are also other kinship placements that are available for children who have DCF involvement, for example. But
Yeah.
the other hardship that children are facing as well is that there are a lack of foster care providers on the Cape. So there's
Oh,
been a marked decrease in the number of foster placements on Cape. So if a family doesn't have a kinship placement, then children are sent off Cape to be
Oh,
placed.
wow.
Which
And
is not,
Hmm.
not good.
It's rough.
It's
So I think
it's
the
already a situation that they need to be removed from and then bringing them away from friends and the things they already, their school, et
Yeah.
cetera. Oh. that's
Hilda's
so-
already depressed, so we won't go into
Yes.
more detail about that.
Anymore, please.
I know. Hilda, I'm with you.
But
Get out of
it is-
here.
Yeah.
Because we have an older population here, we do have a lot of grandparents, and if not, they may be parenting totally and have custody of their grandchildren, or they have it's a child with grandchildren has moved in with them, and that happens frequently too.
Right.
Especially in this kind of economic times, when
Mhm.
they've got one house, it's a way to sort of reduce expenses and such, so we end up, I know this happened in another cycle, probably, 20 years ago, whatever, when they thought the population of kids was going down. And then all of these people ended up moving
Oh, that whole.
back home, basically, or, their parents have now retired here, but this is where they live, and so then they come and live in the basement or whatever, and.
Well, and the school system is good too, so
It
I would
is a
think
good
that
school
that would attract. That's what I was even wondering, well, are they not in such a good school system? Do they send their kids to, their parents who
Yeah.
live in a good school system? So I even
Hmm.
wonder if that had,
Yeah,
but I thought that was high, I was
yeah,
shocked.
I don't
I
think
I don't,
that
I mean,
is,
I'm hoping that was not correct.
yeah,
can't
I
remember
don't
Tom.
think that is probably correct, but it
Oh,
would
that's
be
good.
an interesting, yeah.
Good.
He probably can, it should be. I don't know,
Public information. I don't know.
I don't know.
I don't know who-
Somebody counts it.
Who's up with it?
Yeah.
Everybody, it's such,
But I'm sure the school system does. They have to know who,
who the
who
parent,
everybody's
who's starting
guardian
the
is,
kids,
yeah.
yeah,
Yeah,
yeah.
so, yeah.
all right, well, Lower Cape Outreach is just a regular stable. I mean, they have been around for so
Yeah.
long, and it really, actually have really grown over time in what they do, and the idea that they actually, it's in the application, do counsel people, I think that
Yeah, I
that
think
makes,
that's wonderful.
a big difference, and, but yet, and now they're having all these new people coming in, even just to access the pantry, for them to then find out that there's other that they might be able to get help with, as when their electric bill spikes in January, that they could at least maybe get some, maybe not the whole thing taken care of, but just some things and stuff.
Yeah,
Awesome.
having the capacity to provide additional services is like an evidence-based intervention. So it's one thing to address someone's concrete need enough for them to be like stabilized effectively, that now that they can think through things a little bit easier because they don't have to freak out about not being able to feed their children. But then also, so then having that capacity to dovetail, like, we're going to take care of your concrete needs, but then we're also going to provide you with some education, resource navigation, coordination. Like, that's an evidence-based intervention. So it's, in my mind, it's like the best, like a gold standard of care that they're trying to provide, it
Yes,
seems.
yeah, and for maybe not everybody, but I would bet that there are many of the people who come in and their approach is going to be gentle in how they're, you know, they bring it up, but at the same time, to really help them look at you know, a way forward, even if it's just for the next 2 weeks, you know, how can you, you know, because it's gotta be so stressful, and that just, you can't think straight.
Mhm.
And, you know,
Mhm.
then you go out and you end up splurge buying the wrong thing, and then, or whatever, you know, I know I would. The
Mhm.
fancy coffee that you shouldn't have gotten when, you know, but, anyway. So then the next one, talk about depressing Hilda, when we have,
Now you're gonna depress me some more?
well.
Thank you, ladies.
You
I'm
know,
looking
the
out
AIDS
for me.
support group, which is, you know, it's
Oh.
very, it's again, a long-term organization, but it's also one that is dealing with a layer of the population that, we, you know, people look around and don't wanna see. Basically.
Yeah.
So I
Yeah,
feel.
harm reduction services are, again, a gold standard public health intervention.
Yeah,
Um,
and you're quite involved with it, and I just feel like. Adding the layer that you do at the children's place for the parents in their. You know. A little more of their everyday life. I think makes a big difference to help them. Begin to move forward. I mean.
mhm. Yeah, like, we got to keep people alive
Yes.
so that they can then stabilize enough to engage in services and gain
Right.
something.
Yes.
And that's the
And-
important work that AIDS support group does.
Absolutely, absolutely, and they've been doing it, and then you know, as. HIV became a little more manageable, they pivoted and, you
Mhm.
know, are taking on. More of the local, and Jill probably will be walking in. As we have Jill Brookshire coming, and she is a local resident, she lives in Eastham.
Ah,
Oh,
good.
Has forever. And the husband, her. Parents. Worked at the Soubrette forever. And her husband did too. Wow, her kids have gone through the schools, yeah, Jill's famous. Involved. But, and then we have some people that will be coming in through Zoom too. Or actually one person, because.
we're all old enough to remember when the AIDS epidemic started
Yes,
and how thankfully how things have changed a little bit.
yeah,
I've changed a lot,
Don't you
a
think?
lot.
I was teaching nursing at the time,
oh, yeah,
and one of my students who was an older adult
Mhm.
student. I had assigned her to an AIDS patient, and she refused.
ah,
And I said to her, if you refuse, I will flunk you on site. I have to. You cannot refuse. But she felt that strong.
yeah, it is,
Well,
yeah.
that- yeah, when it first happened, people
Everybody had.
really ran from other people in Robertstown, people would run to see someone.
Yes,
get away
yes.
from them. So there was I mean, it was a tremendous stigma,
Oh,
and really it took the nurses and probably a handful of women to make a difference there, to shake these guys up and getting them start with care, system care. But it worked, and look what's growing out of it.
What's
Yeah.
grown out of it is again, yeah, yeah,
But it took a lot of radicalism.
yeah.
Yeah,
And thank God that, who was the guy that was in, the young guy who just headed up, the COVID stuff, so it begins with an F, he's 80 years old now, the guy who retired,
Fauci,
Fauci.
Fauci, he was involved in it, yeah.
The
Oh, yeah,
act-
he was the head of.
being able to,
Right.
to respond,
Yeah.
listen,
Yeah.
and make a massive change. It's very hard science.
Very hard.
And-
Never
and
want to
very-
take that.
But it's very hard in that kind of structure where they're, it's kind of what Kennedy's trying to do, but he's a nutcase. But I do think that we do want to make institutional change and research organizations and what have you, and there's always a focus. It takes something very radical on the outside to break that up, like a change.
Yeah.
Hi, come on in, come on in.
Come on in. Come on,
I'm
sit over here and join us. Keep looking to see. Eliza, it's Eliza.
Eliza, yes.
Yeah, she'll be joining us through Zoom. But, so how are you doing?
I'm doing, how are you?
I'm still doing this.
Thank you.
And you're still doing,
I
Yes.
yeah, started in 98.
98?
When I was 14.
It's just child.
Told up most of it. My goodness.
Did a great job.
Yes, right. And your girls are doing well.
Oh, yes. Kendra is at Fort Cities.
She is.
Yeah, she worked for a year and she's like, my oldest went, well, both of them went to Cape Cod Tech.
Okay.
And my oldest daughter, Kendra, she's 19, she did auto collision, so she painted cars.
Nice.
Worked at Don's Auto Cosmetic in
Oh,
Brewster,
okay.
and yeah, she loves the
can't
family,
go
yeah.
there.
Yeah, she loves it, but it became a grind really quickly, and she was, like, oh.
Yeah.
Yeah, you're 19, no, I'm like, oh my goodness, you're 19, you don't, you just do something, keep moving forward, you know.
Right.
So she decides to take courses at Four Cs, which is great. It's free as well.
Yes, yes.
Yeah.
And Maggie, who graduated in June, she is at Bridgewater.
Right.
Yes.
Yep, yep.
Exciting, yeah, she was
Yeah.
salutatorian. Yeah, the second year class, I know.
Yeah.
She told me.
Yeah.
I kitchen, I'm like, I'm sorry, what, so I'm like. Right. It's just like, I'm smart enough to know what that means. So I'm like, oh, I heard this. I know they had the pleasure of being their
Yeah,
preschool
yeah,
teachers.
I did. So, great kids, good family, you know, but,
Thank you.
but it is, yeah, but it's really neat to see and, gave them their space, and Bridgewater has become quite a school these days. It is,
Yeah, no, it's a nice school. So like, she comes home every weekend right now still, but,
She'll get over that.
exactly, in her own time, she
That
will.
happened in her own time.
In her own
Yep,
time, she
yep.
will. But no, she's enjoying it. Yeah, yesterday she was up in Boston. They went to the city, because there's now a tea stop right on campus.
Okay.
Into the city.
Oh, yeah.
Oh, yeah.
I get it.
Friends went into the city, so like, okay, go explore.
yes, she's seeing, yeah.
Yes. Yeah, she,
A gentle way of seeing the world in a way, but yeah.
yeah, when she was in high school, she did 2 trips overseas. So she's been more places than I am.
Yeah.
Yeah.
Now's the time, go when you
Yeah.
don't have
Responsibility.
responsibilities.
Right,
Yeah.
all right. So this is a committee that has been around for a little while, but you haven't really met any of us. I mean, you've met me, Kate,
Yes,
but
no, it's been a while since I've been.
you've been to one of the
Yes.
meetings and such, so we can.
Hi, I'm Dee Mattville.
Nice to meet you.
I'm Ellen Greer.
Hello, Ellen. Nice to meet you.
I'm Helen Morley.
Hello.
Mary Jane Samuel.
And we have Felice.
Okay.
Hi,
Hi, Felicia.
hi there.
And Billy.
Hello, Billy. I'm also an East Ham resident.
Yes.
So,
Yeah.
Yeah, I was saying that before you came in the door, it's like, yeah, shoot, but.
I'm a Wash Ashore. I'm not local. My husband likes to remind me of that. 2 children here.
Yeah, exactly. Your kids are,
My kids aren't, my husband's local.
Okay.
I was born and raised.
yeah. But anyway, have they set the date yet for next year's, old timers?
So unofficially, are we on tape? Unofficially,
Actually, we are. So.
oh, so no.
Talk to you later.
Yes, actually, 'cause we had a meeting Friday night about that.
Cause I know every night, I remember last year running into Jamie right after it happened. Yeah, we just had a meeting.
Yes, I know it's a Labor Day is not until September 7th,
Oh,
2026, so it's going to be a later
Yeah.
full timers as
yeah.
well.
So you have to look at the
How about
time.
the
The
services?
tides.
Oh.
Yes,
Yeah.
my husband's,
It's
Okay.
really fun.
it is. fun.
Yeah, it looks
It's
fun. So
really
you
a
didn't get
fun
to do
thing.
it this year, right?
No, they didn't, they called it day off.
Yeah.
Because it's,
Because of the,
Storming or?
well, 'cause it was so bad, the
the current and the.
Current.
the waves and everything, cause the year before, the waves were bigger than anybody they've really ever had. Some very surfable waves, but some that weren't, and it was, the
Yeah.
water was really moving, and there were some issues, so they,
Mhm.
yeah.
And this year with the storm,
And
there
they're
was a
all
storm
old
that
timers,
happened.
right,
Yeah,
doing it?
yeah.
Yeah. it just
Well,
was-
not everybody,
Okay.
but.
No, not everyone, but
Are you
it
a
is,
surfer?
yeah,
No,
Okay.
not any, I boogie board, but
Okay.
yeah.
it's,
I don't surf either, just watch from the shore.
I love watching the surfers.
yes.
Yeah.
Oh, it is, it's really beautiful. Okay, we don't have Eliza yet, but we can get started. She'll get here.
Yeah.
Of course, it's not, we had said 7:30, so
7:30, I
she's
know.
probably sitting there waiting to click on at 7:30. Cause we did just finish with another one. Well, and be sure you say hello to your girls.
I will.
I run it from there. She is. Admit her. Ding dong. That was funny. All right. Hi, Eliza.
Hey there. Hi,
Hey
Billy.
there.
Hi, Jill.
Hello, Eliza.
All right, so now we have, just so we have this on tape, the AIDS support group of Cape Cod. We have Eliza Morrison on Zoom and Jill Brookshire here in the room with us. And if you want to get started, one of the two of you, I don't know how you figured it out, just to give us sort of an update as to what is going on with.
We actually don't have a game plan at all. We're sort of
Because we don't either, but that's all right, no.
Yeah. At this point, we're pretty good at winging it though. So I guess Jill could probably tell you about some of our medical case management services, and then I can go ahead. I've got a couple of slides about the other services that we are providing currently in Eastham.
Okay.
Yes, so, yes, I am up. So with our name, the AIDS Support Group for Cape Cod, the services that my team provides is probably historically what a lot of people think of. We are providing services directly to people who have been diagnosed with HIV, regardless of age, income, anything like that. We open up our services to anyone because with the diagnosis often comes stigma, isolation, depression, that will affect anyone regardless of race, religion, socioeconomic status, all that. So, I'm the director of case management for the AIDS Support Group of Cape Cod. We have 3 full-time case managers in the Provincetown office. We have 2 full-time case managers out of our Hyannis office and a housing specialist out of our Hyannis office who can work all across the Cape. That is a relatively new, that's probably
Yeah.
only in the last like 5 years of a position. Where housing, I think everyone knows how bad housing is on the Cape. We're working to try to help people find housing, prioritizing people who are unhoused, people who are about to become unhoused, people who are in situations that aren't ideal, to say the least, that kind of thing. So we provide the services directly to people living with HIV. And our job, we do not tell people what to do. Our job is to help people identify what their needs are and then find resources in the community to help them meet those needs. So specifically around, primarily we are focused on making sure people have health insurance.
Okay, yeah.
I know more about Medicare and the Health Connector and Mass Health than I ever thought I would, but I sort our client list by age. I know we have 22 people turning 65 next year that we will be working with them to get them onto Medicare, help them make sure they transition into Medicare, they have full prescription coverage, all that. So it's medical insurance, making sure people have doctors and access to those doctors. So with that can come transportation, just all, accompanying people, even if somebody has a colonoscopy scheduled, you can't drive yourself to that. Like somebody has to go with you and drive you. So transportation, and then so it's the insurance, medical care, benefit coordination, whether it's around disability or SNAP benefits, or there's the HIV drug assistance plan that we can help connect people to. There are some rental assistance, programs. We do housing coordination. We do all things like that. We can do referrals to mental health providers, substance abuse disorders, like work with folks to get treatment for that. So, but again, it's up to the person.
Medical piece.
Mhm.
How about the medical piece?
The medical piece, absolutely.
So that,
Like connecting them to the doctors, making
Right.
sure that they're seeing specialists, making sure they have a doctor, which is always tricky these days. You have people who move here and they're like, okay, so I need a primary care provider. I'm like, good luck. But we work, really, it's not my answer, but it is like, so you still connected with your doctor back home for the time being? Can somebody mail you your prescriptions while we're working on getting you into a provider? Especially the infectious disease providers, it's really out of health services. In Provincetown, the infectious disease clinical services of Cape Cod Healthcare, which is in Hyannis and Falmouth, and then Duffy Health Center has a provider or two. Harbor Health has a provider, but it just depends. So
Yeah.
yes, that too. So just, working with folks to help them. Like I said, like, what are your needs? How can we help you meet those needs? It's up to that, it's not for me to tell you, this is what you should do. It's not my life, it's your life. You tell me what you want to work on, and then we'll see what we can do.
How many clients are you working with now?
Total,
Yeah,
Well,
your
what-
group.
our agency,
And
over the year, course of a year, we work with like over 300 people, Cape and Islands wide. There's definitely more people living with HIV. Not everyone is accessing our services, but that right now is about what we're working with.
Yeah.
Over a course
And
of a
on
year.
here it says 4.
For Eastham.
Yeah,
or at least them.
which
Right now, yeah, but it all,
it
it
could change.
could change at any time. That's for people living with HIV. When I hand it over to Eliza and she talks about the harm reduction services that we do, that's more like probably community,
Okay.
a wider
Yeah,
catchment in the community. So,
well, because we were speaking before you came in the door about remembering what it was like when, HIV was first.
before it was just not.
People would run away from it,
Yes.
it was.
You were
such
spreading
a
it, it was
stigma,
spreading.
and it's just.
The COVID pandemic very much
Mirrored it.
mirrored it.
Yeah.
Oh, yes, some of our longtime clients were talking about like that initial like panic of people like, don't get near me, don't, you have to stay far away from me, you have to
Right.
wear a mask. And
It's,
I'm one of my
they were
clients.
remembering their trauma from
yeah.
how they had been, but also then they also could share that trauma with other people, and maybe somebody got a little inkling of an understanding.
Yes.
Not everybody, or people
Oh.
seem to not remember what it,
But, yes.
how
So-
that was, but anyway, okay.
So that's that's like the side of the house, I always call it, that my team works on, but and we do work closely with Eliza and the harm reduction specialist.
How
But
many are on your side?
so like, so it's the staff members, and then we work with about over 300 people in a given year.
How many staff people do you have?
Oh, yes. So, well, for case management, there's the 3 in P-Town, 2 in Hyannis, the housing specialist that I oversee. We also have, I'm pointing at P-Town and Hyannis directions. In P-Town, that we have we have a chef who prepares a daily meal, Monday through Friday.
Right.
In Hyannis, we distribute food boxes all the way from Eastham down to Bourne. So there's that, and then
Did you have volunteers?
we do have volunteers.
okay.
Yes, we have volunteers. We love our volunteers. We couldn't do this work without our volunteers.
Yeah.
Volunteers will do rides for folks,
Okay.
deliver lunches Monday through Friday. There are some people sign up for that. We have, events that people work at, answering the phone sometimes, it's like that.
Yeah.
Yeah.
Well, because you had some amazing
Have you seen over
fundraisers
the
too.
years, the level of severity and, you know, the impact that the disease has? Because I mean, it's such a, I mean, at the initial, you know, diagnosis and stuff, but it's not, you know, death warrant like it
No,
was,
it's
you know,
definitely.
30 years ago.
It's very much, generally a manageable diagnosis now.
Right.
Medication has come a very long way. You know, anyone who's newly diagnosed, the first thing we say is, you take control of this. This does not control you.
Yeah,
You control, it doesn't define you either. You define who you are.
Right.
You define it, and then give people the tools and resources they need to live as healthy of a life as they like to.
They can't afford the medication. So that's
Yes.
something that you help them.
So we help make sure that they have full health insurance. There is a program, the HIV Drug Assistance Plan, which can help pick up the co-pays of people's prescriptions. As well as it will pay for somebody's health insurance plan up to 500% of the federal poverty line, which is about 70. Oh God, I used to know this off the top of my head. It's around 74,000.
Okay.
I think.
Does the Ryan White thing? get
So
involved?
yes, the Ryan White grant does get involved. It is not directly to us, but to the state and to some of these programs. So the HDAP program receives some Ryan White funding, the dental program for people living with HIV receives some funding, the health clinics out of Cape Health Services, infectious disease clinical services at Cape Cod Healthcare, they definitely get Ryan White funding as well. Just there's the A through F, I think, of Ryan, the different categories of Ryan White funding, which if you, I've got a little sticky note on my wall at work that breaks it down for me.
Yeah,
but I-
yeah.
I just
It's
can't
okay.
remember off the
It's
top of my
okay.
head,
But
but
Can't
it-
imagine
it-
why.
yes.
Yeah. But it's, they're. See, from the initial diagnosis, you are really helping them see a path. And where there's stops along the way to get them, you know, connected and services and supported.
And supported and
And,
we'll work with somebody for as long as they want us to. work with
right,
them.
and then there's
Absolutely.
continual support, so
Yes.
that, yeah,
Absolutely.
because
yes.
that's how they're going to. Get healthy,
Yeah.
make it, you know, once they, yeah. So
Absolutely.
then they don't necessarily have to go into the harm reduction program because they're not gonna use anything else.
Well, possibly, or I mean, part of harm reduction is around sexual health screening.
Yes.
And with HIV is very manageable with medication, folks can become undetectable. When
But
they do blood work,
Right.
and in a milliliter of blood, you can't find the virus, it's there, you can't find it though, it means you're not transmittable. You equals you, undetectable equals untransmittable. It's a wonderful, wonderful thing, and folks are still sexually active.
yes,
Healthy
yeah,
people, so, yeah, healthy lives, so getting screened for other sexually transmitted infections, absolutely, and. If somebody is using any substances, then we
Yeah.
absolutely do a very warm handoff to the harm reduction. team
yes,
for
yes,
services
yes.
and-
But I think the most powerful line is
Nope.
in here was. You continue to meet individuals exactly where they are without judgment.
Yes,
And to me, that was
absolutely.
the first way for people, you know, who've chosen different, who for all kinds of reasons have, you know, a lifestyle that is not what people perceive as this a mainstream path.
Mhm.
And really there's that's what,
They're people.
yeah,
Yeah,
but they're just
Yeah.
people, and that's where they are,
Yeah.
and there's.
There's people.
If
It's
you
a
look at-
big spectrum of people, and that's what we have to begin to accept, everybody does, and
Yes, for where they are, for
From where
what
they are.
their life experiences have
Yeah.
been, how they're. Focused and just keep them where they're at, treat them with respect
Right.
and.
that respect probably gains you a great many people coming back in the door.
It does. It also, and I'm sure Eliza's gonna speak to this, when somebody is using substances, and they're working with us and we're meeting them where they're at. When they're actually ready for recovery, we're the people they come to.
Yeah,
And we can help them because we haven't shamed them. We haven't been told like, what are you
Right.
doing to yourself? Why are you doing that to yourself? Of course, you have like just diagnosed with this or that, or,
Yeah.
what else would you expect? No, we do not do that to people.
yeah,
They're getting it pretty much everywhere else in their lives.
everywhere else, exactly, yeah.
It's safe here,
Yes,
you're safe.
safe. Yes, we are a very safe place. And so people, when they're ready, they come to us and, that's good.
It is,
Good.
it is,
It's
good.
powerful.
It is, as Billy said earlier, right before you walk,
Yeah.
you have to have, people have to be alive
Yes.
to
Treat them.
help them, to
Mhm.
treat them, to help them, move in any distance, anyway.
Yes.
All right,
Liza.
so Eliza,
Sure. So I'm gonna go
Yeah.
ahead and share my screen. Oh, let's see. It looks like sharing is not enabled. So whoever is in charge,
if I can,
she has to go into the booth.
yeah,
Oh, if you go into share,
What's the?
see where
See
it
what's
says
the
share?
green,
What do you
the
mean?
green
The
thing at the
green button
bottom,
there.
at the bottom it says green.
share, oh.
But no, not that, oops, sorry, X that out, up in the right-hand corner. for a second.
Yeah,
All right, now if you go down, but where it says share, but that little arrow next to it, that little white arrow next to it.
Yeah.
Click on that. And see advanced sharing options.
yeah,
Click on that, and then who can share, the middle one? All participants.
All participants.
oh, there it is.
Okay, and then if you X out that, Eliza should be able to share once you X that out. All right, I think,
We'll see, all right, can you do it?
is it allowing you, Eliza?
Yeah. Here
There
we go.
Okay,
Okay.
thank you.
Go ahead and turn this into a slide deck. So Jill already kind of touched on the services that medical case management provides, but I am on the other side of the house, like she referred to before, in what we refer to as our prevention and screening program. So we are a cost-free testing program. We test for HIV, hepatitis C, other sexually transmitted infections. We refer people to care and connection in the community. Could be medical case management, could be gender affirming care. It could be treatment for another type of STI. We also provide housing services. So the same housing worker that works with Jill's clients also works with our participants who are unstably housed, struggling to maintain their housing, or unhoused, who are at risk for overdose or have experienced substance use in their recent history, which has put them at risk for overdose. So we're able to kind of cross-refer and link a lot of those folks to housing services and keep them at least connected to somebody on a home base, which is nice for them to have like a touch point at the agency. We also provide access to PrEP, which is a medication that people who identify that they could potentially be at risk for contracting HIV, either through sexual means or injection substance use. PrEP is a medication that you can take daily, which will, if taken regularly as directed, can be very, very effective at preventing HIV. We also can link people to a medication called PEP, which is a medication that if you take within 72 hours of a potential exposure to HIV, so maybe you've had intercourse with somebody whose status is unknown, potentially you've shared a syringe with somebody, even a needle stick at the workplace, we can link people to PEP, which if taken within 72 hours of a potential exposure, reduces people's risk of contracting HIV by like 90-something%. It's a 30-day medication regimen. So that is really, really important, and one of the newer kind of advances in HIV prevention that's really helping us to see a decrease in HIV, new HIV cases. We also provide overdose prevention education in the community. So Narcan training in Eastham. This year, we actually partnered with Choke Saver Training, which is the training that is required for restaurant workers. And so we've partnered, we've paired Narcan training with that Choke Saver training because we recognize that a lot of times people who are working in the service industry can also be people who are using drugs, and also patrons of bars, etc., can potentially use substances that could cause overdose. So that was a great connection to make, and we were happy to do that with the town of Eastham. Our program also, we are what's referred to as an SSP, or syringe services program. So we provide access to sterile supplies for people who use drugs. And this helps folks to stay free of not only like HIV, hepatitis C, but also other infections that can be acquired through shared drug use. So things like abscess or skin infections and other infection like that. We also are a syringe disposal service. And the great thing about our program is that we generally pretty consistently on a yearly basis take in more syringes than we distribute in the community, because we are able to go out and kind of do these sweeps in the community. We will take syringes from people who use, who maybe not necessarily are using illicit substances. So people who are diabetic or maybe are using hormone replacement, etc. So we will also take those syringes for people. So that's, I think that's always a good point that I like to make. We also provide same day linkage to medications for opioid use disorder and other substance use disorders. So we can link people to like the methadone clinic if that's something that they're interested in. We can link people to medication assisted treatment programs at a variety of different locations on Cape Cod, whether it is a primary care facility or an outpatient treatment program. We have a warm handoff process with all of the primary care, community care centers on Cape that are providing addiction treatment to folks. And then we also provide post-overdose services, whatever that looks like, whether it's engaging with a family who potentially has somebody at home who has experienced an overdose. We can link people to bereavement services, support services for people who are living with people who use drugs, different support groups, etc. People who themselves have experienced overdose, we can link them to harm reduction services so that they don't repeat overdose, because we know that after people have experienced an overdose, their risk for overdose is markedly higher. So we engage with those folks to create kind of a support network and a support plan if maybe treatment isn't either accessible or something that they're interested in doing right away, because we know that that's not always something that happens. There's kind of this perception that if somebody experiences an overdose, perhaps they're kind of like scared straight and they want to go to treatment right away. Most times it's not accessible to folks financially or for a plethora of different reasons. And so, we just try to support folks the best they can to make sure that they stay safe in the period after an overdose. And then we also provide mobile services. So we have a small van that goes out on the Outer Cape. We're there twice a week, and we are in Truro, Provincetown, Wellfleet, and Eastham. And so once a week, we spend about half the day in Eastham. We're at the public library, and then we're also in the community making different drop off and pick up, providing confidential services to folks in the community. Does anybody have any questions about that slide? I'm sorry, I went quickly.
A lot of information.
It is a lot of information, I know.
But you're doing so many wonderful things, but also it seems like you've really, got it's really encompassing a lot of issues and really trying to provide that safety net that's wide ranging to really catch a lot of different pieces. And
Yeah,
pieces of people need the support.
Yeah, I think that when you approach, like we do with a harm reduction approach, you have to kind of you have to have a lot of different options available to people because we meet people where they're at. We don't come with an agenda. You don't have to be abstinent of, you don't have to be sexually abstinent. You don't have to be abstinent from substances to access any of our programming. So we need to have all of these kind of community supports and services in place so that we can meet people where they are. And not everybody utilizes all of these services, but they're kind of available as we move along. And we try to, every person who we engage with, whether it's in the community or they're coming on site to get supplies or Narcan or to ask questions, we do a comprehensive intake with each individual. And we have a kind of a workup we do with folks initially and then on an ongoing basis. So we'll kind of ask them the same questions and maybe some more kind of like leading questions the next time that we engage with them. But, we make sure to ask those questions about like, do you have concerns about food? Do you have any health concerns? Do you have a primary care doctor? Is there a chance that you're pregnant? Have you been tested recently? Are you unstably housed? Et cetera. So, we can make a pretty good assessment of what we might be able to offer that individual. Let's see. So I think we kind of just went over this. This is just a little bit about our van and what we can do on the van. We can do all of our screenings. We can do short-term health navigation, whether that means linking somebody to a primary care provider or any of these services that I kind of talked about before. That comprehensive risk assessment that we can sit down with somebody and do. We can do that comfortably in the van. We provide confidential drop-offs and pickups of, safer use supplies. We do Narcan trainings and distribution. We can get people to same-day medication assisted treatment, referrals to recovery services. We do distribute a lot of supplies off our van, whether it is just, whether it's like basic hygiene supplies, people who are living unstably housed, people who, may need some nutritional support. We have things on the van that we can offer to them. And then we also have a lot of really nice partnerships with communities and organizations on this van where they let us park and offer services on their property. So we are grateful for that. And if anybody ever has any interest or connections in the Eastham community where, you think it might be a good idea for us to pursue a connection with somebody and park the van there, we would love to. We're always open to suggestions. So again, this mobile unit is just another tool that allows us to kind of meet people just right where they're at. Then that was a little bit about our post-overdose program. And I just wanted to touch on the fact that along with our overdose education and Narcan distribution and our public and community and kind of private Narcan trainings that we do for folks, we have 3 or 4 Nalox boxes that are installed in the town of Eastham now. And a Nalox box, or you might hear it referred to as an opioid rescue kit, is just kind of a clear front sort of tackle box that mounts on the wall. We like to put them in municipal buildings. We feel like it's accessible to folks, it's anonymous, but it's also a really great way to reduce stigma around carrying Narcan, substance use in the community, etc. We always advise that people install them if they have an AED in the building, plop it right next to it, and let's just call it healthcare. And each of those boxes holds a non-rebreather mask and also 4 Narcan kits, also with some literature about how to respond to a potential overdose. And having those boxes and that CPR mask doesn't mean that we anticipate, and the data certainly doesn't show that we anticipate that means that would increase the likelihood of there being an overdose on that property. It just means that people who might be at risk, or families who have people who might be at risk, or community members who want to carry Narcan can, have easy access to
You
it.
mentioned 4 properties in Eastham, or you have them located?
I think there are 3 or 4 boxes in Eastham, and I had I had thought that she was going to provide a list of where they were in the grant proposal when she was writing it, but if not, I can pull my list and I can certainly email you and let you know. I know that Hillary has one in her office. Hillary might have two in her. There's
Yeah.
one in town, there's one in town hall, there's one in Hillary's office. Believe there's one in the library.
Yeah, I think
Hillary's
there's the library.
So
Yeah.
there's
The
three.
library?
Yes.
So that's,
Okay, thank you. Library
Yeah.
down there.
so that's three, and there may be more, but don't quote me on that. Our person who goes to on the Outer Cape, does the refilling when she's out doing
Yeah,
that.
so how much has that, how much how often have you had to refill, or how, not often, but how much, you know?
So, Yeah, so generally, so in the grant, I believe in the application, I believe that it should indicate how many doses of Narcan have been distributed
In the chart.
in Eastham. But also I always leave a couple of cases with Hillary, and she does the local refilling of the boxes when they get empty
Yeah.
and we've not been able to be out.
I see that.
Yeah. Yeah, well, Hillary would be the one.
Yeah,
So
because
there-
we want to make sure that, we're just there, a couple of
Right.
times a week. So should there be a box that's empty, we want to make sure that Hillary has
Right,
the means.
right,
or
and,
somebody
and
has
she's
the means
around
to
all the
fill it.
time, really makes more sense.
Yeah.
Should
Yeah,
have
and
them.
we have a really we have a really nice relationship with the folks on the Outer Cape. We have a collaborative approach with the Outer Cape Community Solutions Group. So we're always, taking feedback and kind of, just really relevant current information is able to be exchanged in that group. So we've kind of been able to adapt based on that. So
Because, I mean, besides, and thinking of that, the police have it, and it's, on the rescue, it's in all the fire vehicles, et cetera, so.
yeah.
It's out, but it's also needs to be in places where, other people can access it.
Yes.
But I know the library because I, volunteered there.
Yeah,
I was
and
told that was there.
The library has been great about trying to kind of incorporate some of the services that we offer into the materials that they distribute. They're even really motivated to, help to create kind of an environment where teenagers and younger folks feel comfortable getting information about, maybe some sexual health services, some substance use services. What is Narcan? Can we get curious about this? So that is, that's very progressive on Cape Cod, and we love that we love them at the library so much. They're so nice.
Right. Oh, wow. A lot of good information.
So Eliza, just such great wraparound, services that you guys have. It's really amazing to me. Do you have to have been tested positive for HIV to qualify for all those things? Could you just be
No.
a straight up substance abuser?
No, so yeah, so we see a whole spectrum of folks. So
Yeah,
who we call our our medical case management clients, those are the folks that Jill works with. So Jill and her team work with the folks who have a diagnosis of HIV, whether they've come to us through a
Okay.
referral from their primary care provider, maybe they've come from out of state and somebody out of state has referred them, maybe they've tested positive, maybe they've been referred by Cape Cod Healthcare, infectious disease, whoever. Oftentimes there'll be somebody that we test in our program, and we then make a warm handoff to Jill's team to connect them with care. We do get people who just walk in and say, I Googled you or whatever. And then we can make that referral to medical case management. The folks that we work with in the prevention and screening program, they might today, for example, we had somebody walk in for our testing program, not somebody who used substances, someone who had who had had sex with a partner that was not well known to them, wanted to be proactive about being tested. So that was another person we saw. We then saw several people who just were interested in syringe services. So they came in, they dropped off some used syringes, picked up some sterile supplies. We did our intake, checked in, etc. And then, you know, we also had a client who was accessing our syringe services program, but is also a client of our housing worker and needed to make some photocopies to be sent to her. And then we also had someone walk in because they were looking to carry Narcan just for their own personal use, not a person who used substances at all. We also have people who walk in and make donations or are just curious about what we do. So it really runs the gamut. Sometimes we have people who come in for syringe services and we say, hey, have you been tested lately? Because I don't know if you remember, but we offer this testing panel and you know, if you're interested, we could get you in right now with the phlebotomist to be tested. It takes about 5 minutes and they say, yeah, sure. So they might have a couple of services. So it depends on the person, it depends on the day. And then, you know, we work with a lot of people who are in early recovery. We know that recovery, also harm reduction needs to be a really big piece of early recovery, ideation about recovery, people who are in recovery, because we know that those people may have a potential network of folks that they know who might need our services, or they might have the need to carry Narcan to support those folks. We also know that sometimes people don't have the supports or are not ready to be fully abstinent. So we want to make sure that we kind of catch and capture those folks because they are at extremely high risk for overdose at that time. So providing them with support that doesn't feel like, oh my gosh, I can't believe you just left the program and here we are, you know, because they hear that from their families and they hear that from, you know, yeah. We also have a lot of folks who are in treatment that are still using substances. So, we gotta have a little bit of everything, or a lot of it of everything, you know. And I was just in another meeting in Yarmouth and we were actually talking about, you know, providing services during kind of this time in our history and when kind of so many of these services have been sort of jeopardized. And so it's not been great for morale. You know, I think the people that do this work are just, we're so invested in our people because we know them differently than really, I think anyone gets to know them. Because of that very like no barriers to kind of like engaging with us. So we're seeing more people than we've ever seen. So people who are not US born, people who are trans people, people who are you know, just really running the gamut of folks who are like particularly disenfranchised right now. And so we're ironically seeing a spike in, you know, services like we haven't really seen historically, but also in jeopardy of kind of losing the most funding. So it's a challenging time to be doing this work, but here we are. And we're not going anywhere.
You've created a wonderful, safe place, and the word has spread that this is a place for the people who are feeling disenfranchised, that they can at least go to. And even
boy,
if it's
does it
just
spread,
for
right,
5
Jill?
minutes of feeling safe, you know, but
Yeah.
you know.
Yeah,
And that is often how we get people is through word of mouth too, like.
Oh,
bringing
absolutely.
Friends bring friends in and then.
Yeah, we also we've got kind of a little like clothing pantry right now. And we've received a ton of donations, which is really nice because this is like the first year that we've really had an abundance of like seasonally appropriate gear for people. I'm sure it will be gone really shortly, but it's been so nice to be able to kind of like offer that little bit of extra to people. And, you know, now with potentially food being on the chopping block for folks and worries about that, you know, we're really trying to beef up the services we can provide for people. So anytime
Yeah.
yeah. So if you're in Hyannis tomorrow, come to our food drive at Stop and Shop, and then there will be one next week in Provincetown. So
Okay. Yeah, and so you have had, I mean, incredible reductions in some of in some of your monies.
Yes.
It's probably not done. I mean, as soon as you started saying, you said something, you know, gender affirming care, and I'm thinking, oh, well, there you go. Laugh at all.
Yeah.
And, you know, because nobody understands what it is that really is, you know, and, it's, frightening, but you know, because it was when some of the things I immediately thought of you as an agency as having things cut. But then you have also, you know, you're doing your fundraising and you also have the, you know, right in, say, Provincetown or also in the Lower Cape, you have a lot, you know, people that are going to try to support it. I mean,
yeah.
Yes, thank goodness. I mean, it's tough when, you know, we're in meetings, we are running lean and mean. Like, we have open positions that we're just not filling because of the cuts and potentially more cuts, and being, in meetings, we're hearing about, you know, other programs that maybe we don't get funded for, but like HUD, housing, you know, and urban development. They, for chronically homeless people, have been working on permanent placement. That's been the policy for years, and now they just want to switch it to no more permanent placement, but temporary assistance, and only focusing on people, on agencies that are in line with the federal government's policies. I'm trying to word the way they worded it.
Yes,
This meeting
yeah,
last week,
yeah.
they came out and said it will not be people who do harm reduction or work with the LGBT community. It was the most demoralizing meeting I've been to in a while. And this is like a program the housing worker directly refers people to. And I'm just like, you know, nothing's written in stone yet, but that's what we're facing all the time. It's a little much. Yeah,
Well,
yes.
thank you for doing what you do.
yes,
Well,
yes.
yeah, I take it. Eliza and I, but we love what we do.
Well, it's obvious when you speak about it, for sure. I mean, and as staff, you must also, you have to support one another.
Oh, yes.
Because of what you are dealing with, I mean, just financially, but also just many of the people, you know, and just some of the situations, and you want, you know, you want to stay and shake them and like, what are you doing? But you know, that's not the approach you want to take.
Yeah, exactly.
But you know, after a while, time and time, you need to be taking care of yourselves too.
Yes.
But you know, and
Do you provide mental health services?
So we do have some support groups, not, they're not therapy groups. We do have some support groups for the clients, of the agency. So people living with HIV, there's the Crystal Free group, which is out of our drop-in center in Provincetown. That is for gay, bisexual males, who have a relationship with Crystal, that they might want to look at that relationship. There's that group. Some ongoing support groups.
I will say outside of that, on a weekly basis, on a regular schedule,
Yes.
our prevention and screening program is doing Narcan trainings in the community.
Yes.
Sexual health education in the community. We also work with Cape Cod Healthcare, their behavioral health program, to provide bi-weekly groups. We do like a mindfulness, grounding, and meditation group, and then also an overdose prevention group. So we also work with almost all of the sober homes and all of the outpatient programs on Cape to provide sexual health education and overdose education. We work with the AIM program at Outer Cape Health Services as well to go in and do some of those trainings. So yeah, I mean, we're not offering a ton of on-site groups right now, but if there's ever community
out there.
request, we're certainly out there doing it. We do a lot of
Okay.
training for like human services organizations as well, employees, etc.
And we can refer to behavioral health if somebody's looking for an individual therapist or a specific group, then we can search that out.
Right, search it out for them, because
Yes.
it may exist someplace.
Yes,
Yeah, and, you know, sometimes they exist online, but,
yes. Yeah.
and it's better than nothing, but,
Yes. Yeah.
whatever, all right.
I'll just throw out there too that my experience of collaborating with ASG has been that they offer the most comprehensive care at the highest standard, and they're always looking to gather data and evaluation information so they can continue to improve and refine their processes. So I feel like the best kind of steward of funding. So it's unfortunate that the time is what it is, and we can't take good care of our population without ASG. Like we can't, right? Because then there's this whole swath of community that's being forgotten and at high
Absolutely
risk.
forgotten.
So it's like
Yes,
super vital.
Billy,
Yes.
thank you.
Well,
Thank you very much.
Always
But
with
I
the
think that's, it's very true, you know, it is a population that you know, there's more recent people having come to the Cape and their view of what Cape Cod is versus what us as, you know, real locals understand. It exists here, and it's what some of the fabric that makes it a wonderful community.
mhm.
Because there's such, you know, diversity and such that you don't necessarily see if you're just, you know, out and about, but we do need to support, you know, be there, and it is an organization, obviously, that you do take care of, you know, provide so much for people. Wouldn't hesitate to. Unbelievable, but.
They feel better now, don't we?
I do.
Yeah. It was great. One day I was walking my dog recently, and my neighbor who works at the Elks, she's like, I think I just met one of your coworkers doing a Narcan training. I'm like, I bet you was Eliza. Sure enough, it was. So, yeah.
Yes, yep, and, you know, more of us should probably just have it available in the front of your car.
Certainly won't hurt anything.
yeah.
Yeah.
Go
I talked to Jamie,
find your Nalox boxes. Go grab one.
too, about doing a training.
Yeah.
She might be organizing one at some point with Eliza. So.
Yeah, because I just think that, you know, to
Yeah.
have it,
She's a good one.
Yeah. Yeah. I should have been there first.
yeah,
Yeah, a lot of the local libraries, we've done sort of like a Q&A overdose education evening where, you know, like after work, 5:30, 6-ish or so, you know, we gather in a space like the library or whatever, and community members can come and get some Narcan, ask questions, we do a brief training, and yeah. So if you know, if people are willing to host, we're willing to come.
yeah, okay, all right. Well, thank you, both of you,
Thank
for
you.
coming
Yeah.
and sharing all that you do, and we appreciate it.
Good night. Thank you for the opportunity to speak with you folks again. We'll see you soon.
Thank you.
Billy, bye. I owe you an email. Sorry.
No worries.
Okay, bye.
Bye.
You're both doing great stuff.
Thank you.
Thank you,
Take
yes,
care.
and you know the whole
Thank you.
process.
Please. All right. Bye.
Bye. Yeah. All right. Okay, so.
I think we need one.
Yeah.
We need more money.
Yeah,
Doesn't hurt it. That hurt nothing. I know she said level funding, but.
I don't see how.
well, we can come up.
He
with
wants
a
to
good-
go ask for more.
Yeah.
We
I
can
know,
have
I know
her come,
Jackie
or
said
we can
level
go meet in
funding,
her
but
office.
Listen,
etc.
her
There's-
I think that it would be, it would be wonderful if, I don't know if I'm being recorded. or not.
Yeah.
If Jackie could sit here and listen
Hmm,
to what these people are telling us that they're doing.
Right, she does have some background in a lot of them, but she hasn't seen it.
Well, today,
years.
and today, I mean, you know,
Yes.
yeah, we saw a lot, but it's 100% worse today than it
Yeah.
ever was. It just, remember when the problems are bigger? I mean, you have trans people
Well,
now.
the AIDS is better.
The
I mean,
AIDS
the
is
whole
better.
AIDS thing
Yes,
is better.
yeah.
That's
I
one
mean,
good
that
thing.
is.
I think the
unreal.
overdose, I think
Very
the.
And that
substance
hasn't
abuse
gone away, right?
Haven't gone away. And I was just reading that, I think the newest thing that's gonna be attacked now is the cannabis, the hemp. He's taking away all funding for hemp. He's taking away hemp being available to sell, which is what half the cannabis people are saying.
Who's that? Who?
The federal government.
It's taking away, see it again.
They're taking away, I guess federal funding is available for hemp, for people who are selling it.
Okay.
And so
Yeah,
they're
because
gonna
it's
take
a
the
little, it's a
licensing
different
away.
version.
They're gonna take the licensing away from that, so they're not gonna
I
be.
mean, hemp like that, they make clothes out of it?
No, the smoking. The
Well, but
cannabis
it's,
with cannabis.
it's
Yeah.
different, it's a different variation of it, and it isn't,
Cannabis.
I don't know,
Mhm.
because cannabis is still a federally
Yeah, it's not,
regulated, you
it's
know,
not,
it's a,
legal, it's not
Yes.
federally legal.
Right.
whatever it
But
is.
it's the federal states that they can't do it, I think.
Huh? But they don't give money, the
No.
federal government doesn't give money for,
But they have to be
marijuana.
licensed,
yeah, but that's state.
but they can tell the states.
Well, why
not
don't we
license it.
Yeah, we should
adjourn and I
really
can
do
turn
that.
off
Yeah.
everything we
Yeah.
can. Um,
Yes.
Okay,
All right.
motion to adjourn.
Second.
all in favor? Aye. Okay, it's 8:19.
Thank you.
Good night, Silly.
Really, see, please.
Please.
Bye, good night.
Bye, good night all.
Thank you.
Oh.
I'll send you an email. Yeah, the meeting for everyone.